All right. Well, good morning, everyone. I'm Dr. Art Veyer. I'm President-elect of the Medical Society of Virginia, and we welcome you to MSV's webinar on emerging information in cyber liability during the COVID-19 pandemic. And that sounds so dramatic. It is my distinct pleasure to welcome our guests today, Matt Donovan, Senior VP of Worldwide Facilities, and Sean Liverman, Senior Business Development Executive with the MSV Insurance Agency. I would like to mention the following for CME purposes. Here's the boring stuff. No commercial support was received for this activity. There are no reported conflicts of interest for any individual in a position to control the content of this program or speakers presenting in the program. We are recording attendance and will submit to VCU for CME credit following the webinar. VCU will email you instructions on how to access your CME certificate at the email you registered with. An additional reminder, if you are participating by phone only, please advise MSV after by calling or emailing memberservice, that's one word, at msv.org. Then we will report to VCU so you can receive the appropriate CME. Before we start, I'd like to remind everyone that MSV and its staff has continued to work diligently to pull any and all relevant resources related to COVID-19 on our website at msv.org/COVID-19. We will post a recording of this call on that webpage later today, should any of your colleagues like to listen who could not join us this morning. So we have a large number of people on our call. We understand there will be a number of questions. So there is a chat function on your computer. We ask that you keep your questions to topics addressed today. If we don't get your question, or if we don't get to your question or have one on another topic, please email to GOVT Affairs, Government Affairs at MSV.org. And with all of that being said, please welcome Matt Donovan and Sean Liverman.
Thank you, Dr. Veyer, and good morning, everyone. Happy to be here this morning and representing the Medical Society of Virginia Insurance Agency. Wanted to start off and set up the whole premise here with a 2018 Verizon statistic from their report on cyber breaches. And just a quick quote, the nature and extent of attacks on small business vary greatly. 67% of small businesses experienced a cyber attack and 58% experienced a data breach in the last 12 months. Cost to respond and recover from those attacks averaged almost $385,000. And then I wanted to share one other statistic. The 2019 Ponemon report states that the average cost of a healthcare record in a breach is now $429 versus an average of $150 for other general industries. So with all that being said, there's really not any question that healthcare is not only a primary target, it's the primary target for breaches. And I guess with that in mind, let's kind of jump in. Looking at three different basic areas today, costs and costs, so causes and costs in healthcare breaches, emerging and accelerating risk and some misconceptions, and then some ideas around risk management and risk transfer. So I thought it was interesting in doing some research for the presentation. The primary driver for cyber breaches outside of healthcare is ransomware, according to a couple of the studies that I looked at. And it looks like ransomware is an increasing risk from 42% of breaches in 2014 to around 50 in 2019. But healthcare is different, and I think you'll hear that theme repeated throughout our presentation today. Healthcare, the primary cause of breaches continues to be employee negligence, with ransomware actually coming in second, and then rogue employees third. So I wanted to kind of touch on those causes and then also some ideas of what drives the cost in a data breach. Things like detection, escalation, post-data breach response, notification, and lost business. Basically, the idea being in cost that time equals money, and in highly regulated industries, the time is a little bit of a longer tail situation. So, Matt, I wanted to kind of say good morning. Sorry, I kind of jumped right in there, but I was wondering if you might be able to provide some insight into some of the specific drivers of costs. We've talked about that in the past, and I know you have some specific information there.
Yeah, sure. So, I mean, healthcare is unique just because of the type of information that healthcare has. I think a little bit later in the presentation we can talk about business interruption exposures and things that happen on the business continuity front related to cyber exposures. But with healthcare, you've got a number. You have records flying all over the place, whether it be under business associate agreements to third parties that you need other specialists tapped in, collections firms, insurance collections. Even just sending bills to the patients. You have a lot more touch points, and therefore you have a lot more of an exposure to employee error. Still, I mean, not to minimize the threat and the cost of ransomware, we are seeing a ton of ransomware both in and outside of healthcare. A lot of that is implemented through, and really now with everybody working remotely, vulnerabilities in remote desktop, remote access software. Some of the carriers we work with actually are doing remote network scanning to see if there are any vulnerabilities that are detectable on their end while they're issuing quotes to us. So, thought process being, if hackers can see the vulnerability, you've left anonymous access up, there's a port that's not secured properly, that if the carrier can see it, so can the hackers. And then in healthcare specifically, I mean, we've had in my former life as an underwriter, one claim that really stands out to me is that we had one record. It was a piece of snail mail bill that went to this woman. She had been estranged from her family for 20 years. And she was HIV positive and had hidden her condition from her family for 20 years. The bill inadvertently went to her sister who lived nearby, thus exposing her condition to her family, and it caused all these problems. So when she came to court and started alleging damages for emotional distress and mental anguish, the cost of that one record that was lost, it was a limit loss for us. We lost $1 million on the policy. And it was one record that was exposed. Those are types of things that you don't see outside of healthcare. Maybe a rip-roaring identity theft issue, but it's very, very rare. Healthcare introduces both regulatory severity with HIPAA fines and penalties, and it also introduces those mental anguish, emotional distress claims due to the sensitivity of the data, and that just exponentially drives costs up.
One of the factors that I saw in the report, just kind of, 10,000 foot top level, lost business is also a really high cost factor. And in healthcare, at least the report I was looking at said that the healthcare, as a result of lost business, has the highest number of churn as well. I wonder how that ties in. We talked a little bit about business interruption as well. And you mentioned that a few minutes ago about circling back to that. If you could expand on that.
Yeah, so the policies that we sell, they kind of fit together like a puzzle piece. So a lot of the business interruption exposures we see, they stem from two causes. One would be ransomware on your own systems. Two would be downtime or vulnerabilities that have been exploited on dependent providers. So you've got an outsourced piece of software you have to connect to run the practice. They experience a system failure or a business interruption event from some kind of network attack, and thus it interrupts your ability to conduct business. Healthcare is particularly exposed to business interruption because, generally speaking, the patients are going to have to go elsewhere. If they need to get a screening done, if they need to get a treatment done, if your facility is crippled at that time, they'll probably go to another facility to get that treatment done. So that business is generally forever lost. So these policies, they'll respond in multiple ways where, for the example of ransomware, you have to make a massive payment in Bitcoin. If I go back 5 to 10 years, we'd see ransomware demands of maybe $15,000, $20,000 worth of Bitcoin. In terms of insurance limits, it was reasonable. Now it is not uncommon to see 7-figure demands, or at least high 6-figure demands. I had about 5 or 6 of those last year on the accounts that we work on. So the policies will help fund those, but then during that recovery period, you've got to go through forensics investigations, figure out how much was compromised. The OCR HHS has constituted that ransomware is a breach. You have to be very careful because there are a couple horror stories out there where people go and restore from backups once they get hit with ransomware, and they say, okay, no problems here, we're back up and running. but you've overwritten all of the evidence and all the logs that you could go and contest to HHS OCR that a breach really didn't happen, no data was exfiltrated. You need that information in order to make your case so that you don't basically create a breach for yourself when no data was leaked. But all of this takes time. So forensics investigation, patching the vulnerabilities, getting the systems back up and running, during that time period, you've got a huge exposure to lost net income and extra expenses that are experienced during the downtime. And the carriers can help fund those losses for you on a first-party basis. These policies function with first and third-party coverage. First-party meaning nobody's suing anyone.
Let me jump in real quick. Matt, let me jump
ahead.
Yeah, you're kind of going a little ahead. We'll get to that in a moment, though. I did want to circle back on one thing that you said there regarding OCR HHS as a resource. A lot of information available on their webpage, and we actually have a link to that in the presentation information that we'll leave behind to that website. There's actually a checklist, and that gets again into the risk management piece we'll talk about here in a few minutes, but there's some really great checklists there and other information. So we kind of covered a little bit about causes and costs and gotten into some of that. Let me switch gears a little bit onto that second topic of emerging risk. And you touched on a little bit of this, but I've been looking at some other information from some of our carriers that are talking now about emerging risk. I know that a lot of the doctors are working in the telehealth environment now. So I wanted to touch on that a little bit and some of those exposures. That's obviously ramping up and new exposures. The one thing that I did see this week that I thought was very interesting is that there's an escalation now in phishing attempts where and just to circle back, phishing attempts is actually, you know, where you get that email that's saying click on this and downloads malware or some type of takeover virus. So you get a virus by looking at COVID-19 sites. Let me pause. What we're finding is an increase in emails that impersonate the WHO or the CDC or other maps regarding COVID-19, and so the hackers are using that, and then including maybe a link to a map or something like that, where if you click on it, then you're actually downloading malware. Have you seen some of that, or what's any experience with that yet?
Yeah, absolutely. I mean, we basically have a number of things happening as a result of this. One, you have a number of new touch points. So people are getting communication saying, to your example, you're from the CDC, here's this new release, you should take a look at it. It's unfamiliar senders of communications, but everyone's kind of expecting that right now. So that could run also on the social engineering front where people are sending money for invoice manipulation fraud. They're sending money to the wrong parties because people will get a fake release that says, hey, due to COVID-19 and our remote working structure, we've tapped in this new bank. Please see these new payment instructions. You see people saying, please click here with regards to this new policy procedure to review what we're doing. All of those, you know, the target is a little unsuspecting because they are expecting all this communication as we're all getting a deluge of it right now. So it's just an easier target for a hacker to exploit. And at the same time, you have an expanded footprint. You have a largely remote workforce. Oftentimes, you're introducing new bring your own devices, home networks. There's all these new devices getting introduced that are just new points of foot failure that could potentially be exploited. So yeah, absolutely. Unfortunately, you know, people don't waste a crisis. And when you see something like this happening, it becomes lower hanging fruit for the hackers to try to exploit.
In that same article I was reading about the WHO and the CDC impersonations, if you will, they also mentioned the stresses on systems. And, you know, when you've got, as you mentioned, so many people working from home and telecommuting and that sort of thing, as well as telehealth, creating all these additional avenues of exposure, I imagine that IT departments are a little more stressed as well, trying to keep up not only with that, but now, you know, the additional exposures there. I wonder also a little bit about this Zoom bombing. I'm not sure if you're familiar or if you've heard about that term, but we did just recently get an internal email recommending that we always use the passwords on Zoom and make sure that we've set up the passwords, making sure that we're using waiting rooms to keep people from just dropping right in so you can actually admit people, that sort of. Probably not new news to a lot of folks, but I at least wanted to touch on that during the presentation. to use those resources that are available through the programs to avoid some low-hanging fruit for the hackers, if you will. One other thing, and this kind of goes to the misconception piece we talked about, Matt. I know a lot of times when I'm talking to physicians about cyber liability, one of the initial pushbacks that I'll get almost immediately is that, well, we use an EHR system that's through another vendor and it's hosted in the cloud. And I mean, isn't the exposure or the real liability on that vendor to address any exposure for cyber liability? Wondering if you might want to touch on that. And then also, we spoke briefly about with telehealth and telework, but more specifically telehealth, the exposure through business associate agreements and how that's actually set up.
Yeah,
Sean,
so
Sean, can you do anything to make your screen a little bigger?
I'm sorry, say again?
Can you do anything to make your screen a little bigger that you're sharing?
like just the slides.
We haven't really been moving through slides, just using the cover slide at this point. Can you see the cover slide there?
Yes, sir. Thank you.
Sure.
Yeah, so the short answer to the question is you're not going to find recovery from an outsourced vendor. And we often encourage people when we're working on their insurance programs to get those agreements, whether they're just a click-through agreement or whatever hosting agreement you may be party to take a look through that. Generally, you see that those EHR platforms or outsourced cloud providers, co-location facilities, they disclaim all of their liability. It's, even when you're going, especially if you're going into like an AWS hosted by Amazon, Microsoft Azure, Google Cloud, these companies have huge balance sheets, but they can't indemnify Earth, and that's essentially who's going into their environment at this point. So they disclaim all their liabilities, or they generally limit their liabilities to the amount of fees paid. So you pay 10 grand for some cloud computing or hosted software access. They limit their liability to 10 grand, even if you've lost 2 million health records in a breach of that system. So it's definitely something to keep top of mind, because to your point, I think it's a big misnomer that everyone thinks they've outsourced their liability to a third party. Another good example is Iron Mountain. If you're familiar with the physical record storage company, they've got the trucks driving around and they're carrying out file boxes. They've been tested in court. They limit their liability to $2 a box. So you could store gold bars in those boxes. If they lose a box, they owe you $2, and they're really definitely not going to be paying for your breach response expenses. The other side of it is kind of interesting. And everybody, I think, business associate agreements have really become boilerplate. Anytime you get into an agreement where you're exchanging health information, everyone understands I'm signing a BAA, and that's just the way it goes. But when you really take a look at what that's doing, on the privacy side, you have two things under HIPAA. You have a HIPAA-covered entity and then a business associate. And the HIPAA-covered entity is generally the person who first is entrusted with the health information. And then wherever it goes from there, those parties are business associates. And most healthcare facilities have many different situations where sometimes you're the covered entity and sometimes you're the business associate. The way HIPAA works is the covered entity is the one responsible for the breach response. So if you are the HIPAA covered entity, let's say you were lucky and you found an outsourced provider that was willing to indemnify you for a breach. They may say, hey, great, I've got my insurance policy, I'm ready to go. What HIPAA requires is that you as the covered entity provide the notification to the affected individuals, offer the credit monitoring, you may have regulatory obligations, and then you can seek indemnification from the breach of that business associate agreement, but there's a huge upfront cost that you are going to come out of pocket at a minimum for a small period of time. The other side of it as well is a very good example last year with LabCorp and Quest Diagnostics. Those two companies had a combined total of 12 million protected health records that were stored in AMCA's database, which was breached. AMCA, about a week later, declared bankruptcy. So that doesn't remove the obligations from Quest Diagnostics or LabCorp. Now they're coming off of their balance sheet to handle that data breach. So, I mean, oftentimes just having a unique perspective in insurance, especially these providers, hosting facilities, EMR companies, I'd say 99% of the time they have nowhere near the insurance limits available to actually pay for one of these events if they really were trying to indemnify somebody. Even if those contracts look good, you look at the limits that they carry, and there's just no way that they will go the way of AMCA if a catastrophic event occurs. So we oftentimes too, just real quick, we try to sell some of our top markets that we work with. We try to sell the concept where, and only a very few insurance carriers will do this, in the instance where you are a business associate, where the insurance contract says if you have previously agreed to indemnify somebody for the breach of records that you're storing on their behalf, we will offer to pay the first party breach response costs, the notification, the credit monitoring on their behalf, rather than requiring them to come out of pocket and then sue you for recovery under your insurance policy. So it's kind of a concept that allows certain aspects of that policy to extend to those third parties where you may have signed that business associate agreement and you're looking to indemnify that person. You don't want to get to a situation, especially in a rural situation, where you might have one client and you say, yeah, I've got an insurance policy, but I need you to sue me to get access to it.
So a good place to start looking for that under your policy is what, who's covered?
Generally, it's got to be some sort of contractual liability grant. So you're going to see either a enhancement section of policy, an endorsement, or some sort of breach of contract grant that says, you know, if you have agreed to indemnify these people, we're going to pay these particular expenses on their behalf, just to keep the lawyers out of the middle for as long as possible.
Interesting. Yeah. Okay. So some good information there on some misconceptions and a few of the accelerating risk of COVID, that sort of thing. I wanted to talk a little bit about risk management, risk transfer, kind of what we get involved in on the risk transfer side anyway. Risk management, I just wanted to put a couple of ideas out there. We're certainly not risk managers by any chance or by any stretch, but we can give some ideas of what we're seeing and maybe make some suggestions. You mentioned earlier the HHS OCR site. Again, there'll be a link to that. They actually lay out a 5-step preparation process, including preparation, detection, containment, recovery, and post-incident review. And I actually pulled down a few concerns to avoid, things like unsolicited communications, especially where they're getting communication from organizations, companies where you don't have a relationship. You want to avoid some of that. And I've heard this said a number of times, if you get an email with an overwhelming sense of urgency, you want to take that with some concern. Links that don't match. So if you roll your cursor over the link and you see that the link pops up as inconsistent with the email address or message content, don't click on it. And then always independently verify the source of emails or phone calls requesting additional information, providing wire transfer instructions. You mentioned that earlier. Just a couple of risk management tips. Also, of course, use encryption. Can't stress how important that is. Having lost a laptop in the past myself, I've seen the firsthand results of what can happen with that. I was going to actually add to that. You know, we actually are, through the MSV, have some partners that we work with that do provide IT resources or supplemental IT resources that can work with practices as well. To help you guys establish those risk management solutions. So getting over to a little bit of the risk transfer piece of what we do. So the basic coverages that are included with the policies that we represent, Matt. First party, you mentioned earlier, which would include loss or damage to electronic data, loss of income and employee information, cyber extortion, notification costs, and damage to reputation. That's some of the things you were touching on earlier with first party. And then third party being network security and privacy liability, electronic media liability, and regulatory. So these are your kind of your underpinning of most policies. I wonder if you could touch on some of the other coverages that you're seeing come in now on. I know you guys represent quite a few different carriers that do cyber liability, and we're very pleased to be working with Worldwide Financial these days. as one of our brokerage partners. So I was wondering if you could touch on some of the other coverages that you're seeing that are now applying to some of these cyber policies.
Yeah, so I mean, cyber policies, over the years, even from the business interruption front, they originated covering your network, and then everyone started kind of moving into the cloud and said, okay, what about their network? I'm dependent on that. So these policies have become rather intricate, where you have to break down, an overlying concept that says business interruption. Okay, so what kind of business interruption? I know there's one market that recently sent out a bunch of endorsements expanding coverage. We don't work with them, but I just kind of saw it in the marketplace. As soon as COVID-19 hit, they had to expand their definition of network to ensure that it covered all the home computers and the devices, because you've got definitions that could restrict coverage if what the carrier considers to be your network doesn't expand to cover all these new kind of vulnerabilities that could exist with new devices, new networks being introduced. We're actually starting to see contingent bodily injury leak into these policies as well, which is kind of wild. The example is like Secret Service asking Dick Cheney to turn off the automatic updates of his pacemaker. So you start to have all these network connected devices that in theory, we haven't really seen it, but in theory, if a network attack hits them, it could cause real problem and actually start to cause bodily injury, true bodily injury, not just mental anguish, emotional distress. We're also seeing expansion on the cybercrime coverages. You can often get sublimits kind of adapted from the crime insurance marketplace onto your cyber policies. One huge one is social engineering, and that covers the voluntary parting of title, meaning somebody tricked me into sending money. I didn't send money under duress. I wasn't held up at gunpoint, but somebody hacked the CFO's email and sent an instruction to accounts payable saying, hey, please wire $100,000 to this vendor over here. Turns out that was a bogus instruction, and you just duped into sending the funds. There are
under crime, Matt, under a crime policy. Would that be historically covered under crime as well, or where does that line drawn?
So there is some duplicative coverage depending on the breadth of the crime policy that's in place, and sometimes we'll structure the program to have one stack over the other to essentially have double the limits available. But then when you get under the hood and read the wording, one or both of the policies could have a precondition that says, unless you made an out-of-band verification, an additional callback to verify that those instructions were indeed legitimate, coverage will not apply. So it's my job to either make sure that that precondition is knocked out of the policy form, or that at least, it's in red lights and you're aware that it's there. So, little things like that, there's some gotchas that we try to make sure don't exist in the policies that we place. And then in the last about 18 months, that concept's been turned on its head in what's called invoice manipulation fraud. And that scam is where somebody gets into the insured's email and they send a fraudulent invoice to the insured's customer, pretending to be the insured. The customer sends funds to a hacker, thinking they're sending funds to the insured, and it's the insured's fault because their email was compromised first. So
what do you mean?
Getting...
Right.
Yeah, so they've kind of taken these concepts and turned them on their head and expanded them a little bit. So those are some of the evolving ones that we see of late that actually we're seeing kind of a tremendous amount of claims on them as well.
So what we do at the agency here, in working with Matt and brokerages similar, is actually do what's called a cover and exposure analysis. And I mean, we do suggest that. Matt touched on it a bit in what he's looking for in the cyber policies, and we work with them to make sure that our cyber policies are up to your needs. We actually take a 10,000-foot coverage and exposure look at your overall placement of coverages. That's why I ask about the crime versus cyber, that sort of thing, where those overlaps might be, what we're looking for. Also looking for gaps between the policies. So one other thing that I've noticed, at least, and this may be old hat now, Matt, but some policies are reimbursement, some of them are pay on behalf. You run into that, I'm sure. You want to look at that. And at the end of the day, we'd be happy as an agency to offer proposals to our clients or to the doctors of the state, or if nothing else, be a resource for answering questions. And I know we've kind of quickly gone through a lot of information today. We've hit on all three topics that we talked about expanding on. but there's a lot of information covered. So I would just suggest that if you guys have any additional questions on these topics, or you wanted to look at some of the resources that we're providing, we will have slide decks that are available that address everything that we talked about today. If you'd like more specifics or like to talk about those resources, please feel free to reach out to the MSVIA. And we'll work with Matt to make sure we get you good cyber coverage, make sure that you're comfortable and can sleep at night. And we'll open that up and pass it back to Dr. Veyer on that note. Matt, unless you had anything additionally you wanted to add, I didn't want to cut you off there either.
No, that's it. And just would like to, second the offer for, coverage reviews. If anybody has something that, was bolted onto a placement, says, hey, I got cyber, but I don't really know how robust it is, or if it's covering these contractual exposures, business associate agreements, please feel free to ping those over. I'd be happy to do a review.
All right, gentlemen, we do have one question asking to talk about the risks specifically associated with telehealth and telemedicine, since that is becoming so much more prevalent.
I was going to actually ask you about that, Matt. I made a note while we were talking. You mentioned contingent bodily injury with mobile devices or attached devices for monitoring. That's one thing that I saw a note on this week when I was reading up on telehealth, is that's a very specific exposure in cyber now that regards telehealth. And then, of course, we talked about the business associate agreements and the vendors. I'll let you expand on that. But
yeah, I mean, telehealth essentially is just expanding the footprint that is available, like the attack footprint for hackers to exploit. I believe HHS OCR suspended HIPAA liabilities from telehealth temporarily due to the rapid expansion during the crisis here. But that's going to go away if it hasn't already. I don't have the date on me, but yeah, it's kind of twofold. One, you are expanding into areas where there's more opportunities for people to get a hold of that communication. And then two, there's a pretty rapid change in the healthcare, the telehealth provider coverage. There are a couple insurance carriers. Generally speaking, those are tech type companies. Tech and E&O coverage is really for economic damages. It's not for claims for bodily injury or property damage. And there are carriers out there that are covering these e-health platforms that are having to evolve and expand into covering bodily injury claims resulting from a failure of the platform itself. So someone alleges the video was garbled, I couldn't quite hear the audio, and as such, I've rendered an improper medical decision. So it's not just my fault, it's partly the provider's fault, right? So I think when you go into using some of those third-party providers, taking a look at those agreements, those contracts, and seeing what type of insurance limits are in place and whether those limits extend to bodily injury claims or not for the provider that you're using to carry the video or whatever the other telehealth platform is doing is pretty important. So everyone's kind of had to rush into some of these platforms, but taking a step back and saying, okay, what did I click through? What did I sign? What are they willing to indemnify me for? Granted, it might be indemnity. You still might have to come out of pocket for a period of time. And if you're not comfortable with that, you want to bolster your own insurance limits, saying, look, I've got a more efficient way of delivering services. I can have more patients. I can bolster revenues in the future by expanding this approach, but take a step back and look at how much insurance coverage you have, because you might want to revisit those limits if you are expanding into these new areas.
I was going to add to that also, Matt, that you mentioned the OCR site. They actually have in the HIPAA guidelines on the HHS OCR site, they do have a three-step or three-part requirement for telehealth and HIPAA, but it's very, I read over it the last couple of days, and it's very, not vague, but general. So I think your suggestions there are very, very helpful.
Yeah, it's it's kind of a new frontier in a lot of ways, and even though it's been around for a while, but I think that general assumption that, hey, if I'm using this third party, they're going to cover me for anything that goes wrong is just something that everyone needs to get away from and really just be aware of. Is my own balance sheet exposed more than I realize? If so, am I comfortable with that, or do I need to look at risk transfer?
All righty. I do not see any other questions from our audience. So if there are any that people generate after thinking about this, oh, wait a minute. I see Dr. Rhea is asking, please discuss the dark web. Well, that's opening up a can.
The pleasure of
Yeah, I mean, in short,
how to get into it, or just liability associated with it.
I mean, in short, there's a huge section of the internet that is largely inaccessible. It's hidden. You can even refer to the dark web or the deep web, even like your bank. They're keeping a lot of stuff online that is not accessible through just, happening to a website somewhere. The dark web, in terms of hacking and all this stuff, generally what that's referring to are illicit websites that are hosted behind what are called proxies. Years ago, it's actually developed by the Navy. They developed something called the Tor project, Tor. You can Google it. It's also known as the Onion because you're peeling back layers of connections. And what Tor does is if you download this web browser, this is the easiest way to describe it, it'll ping your connection around the globe before ultimately accessing this end website. So it masks where you're actually located. So it might look to the host as if I'm connecting from the Netherlands, but I'm actually sitting in Atlanta. And in using that technology, there are a number of websites that are hosted, hidden behind different firewalls and things that people can get access to that trade illicit information or illicit goods. So it could be social security numbers, it could be payment card records, it could be medical identities. Things like that are traded, they're bought and sold. It's kind of wild if you look at it. They kind of run them like Amazon. You have 5-star ratings available for people that are selling social security numbers and payment card records, and they'll reimburse somebody if they buy Visa cards that have been shut down already, or they'll send them new numbers if they've reached somewhere else to maintain their credibility, I guess, honor among thieves. But it's a little wild. It's really, generally in this context, the dark web is just referring to those websites that are hosted behind protections to keep people anonymous. They generally use a cryptocurrency also to mask the identities of the people buying and trading, buying and selling. And that's just where this illicit business is conducted.
Well said.
All right, thank you. So if there are no other questions, if anyone does come up with anything, please forward them to the Medical Society, and they will be addressed. But I thank you all for attending this morning, and Mr. Donovan and Mr. Liverman, please, my sincere thanks for providing some wonderful information this morning.
Thank you for your leadership, Dr. Veyer. Have a great morning.
Thanks for having me.
All righty, thank you. And everyone have a wonderful day. And as our esteemed president says, stay safe, wash your hands.
All right, have a good one.